Hello, thank you Plant-Based Powered Expo and plant-based health professionals for inviting me to speak to you today about skin. The title of my talk today is Skin Deep, Scratching Beneath the Surface. My name is Dr Sonia Gandhi and I'm an NHS GP at a practice in southwest London. I have a special interest in dermatology and I'm also a certified lifestyle medicine physician working for the newly launched online service called Plant-Based Health Online. So without further ado, I'm going to take you on a whistle-stop tour exploring what the skin is, what its function is, its anatomy, the role of vitamin D, sun and skin cancer, modern day skin problems and lifestyle modifications for healthy skin. So let's look at what skin is. It's the largest organ in the body and it has a surface area of approximately 1.8 meters squared and weighs approximately 16% of the body's weight. What does skin do? Let's have a look at its function. Well, often when we think of skin, we often equate it with aesthetics, and whilst in 2018, the cosmetic industry was worth a staggering $507.8 billion US, it's actually projected to be worth around $758.4 billion US by 2025. Makeup and cosmetics have actually been ubiquitous throughout history, with the ancient Egyptians applying makeup not only to enhance their looks, but also for symbolic and ritualistic purposes. But aside from the aesthetic aspect of skin, it actually plays a significant and essential role in our health and well-being. It acts as a barrier against toxins, chemicals, and unwanted pathogens. It plays a crucial role in regulating our body temperature. It controls water loss. It is a sensory organ. It protects us against the sun's harmful rays, and it plays a critical role in vitamin D production. So let's now have a look at the anatomy of skin. Well, skin is essentially composed of three layers: the epidermis, the dermis, and the hypodermis, which is also known as the subcutaneous or subcutaneous fat layer. The epidermis is further divided up into four layers, and the dermis plays host to sebaceous glands, which are just here, attached to hair follicles, sweat glands, blood vessels, and nerves. Let's look at the epidermis in a bit more detail. It's the outer covering, and as I've mentioned, it consists of four layers: the stratum corneum, the stratum granulosum, the stratum spinosum, and the stratum basale. The epidermis contains various different cell types. One of them is called the keratinocytes. These produce keratin, which is an essential component of hair and nails. It also provides physical protection and waterproofs the skin. There are also melanocytes in the epidermis. These produce melanin and provide skin its colour, and they also provide us protection against the sun. Langerhans cells are also found in the epidermis, and these are part of the immune system. They are the outermost sentinel of the immune system. They keep guard. There are also Merkel cells in the epidermis, which are involved in they have a sensory role involved in touch. The epidermis varies in thickness on differing body sites. So from most of the body, the epidermis measures about 0.1 millimeters, but on the palms and the soles, the epidermis can be in the range of 0.8 to 1.4 millimeters. The dermis lies immediately below the epidermis, and it consists of two layers: the papillary layer and the reticular layer. And the papillary layer contains nerve endings, and the reticular layer contains the collagen, elastin, hyaluronic acid. And together, the dermis provides structural strength to skin. It has all that supportive connective tissue within it. It contains the fibroblasts, which make the collagen, and elastin. It also, as I said, contains sebaceous glands, sweat glands, hair follicles, blood vessels, nerves, lymphatics, and it varies in thickness from 0.6 millimeters in the eyelids to 3 millimeters or more on the back, the palms, and the soles. And then we have the subcutis or the hypodermis layer, and this sits below the dermis. It is a loose layer, a layer of loose connective tissue and fat, and it acts as an insulator and attaches the skin to underlying fascia. Now, skin is not a static organ, it's a dynamic organ, so it changes as we age. When we're younger, the skin is smoother, thicker, and tighter. As we age, we then develop wrinkles, deep wrinkles. And as you can see in the dermis, there's an abundance of fibroblasts, an abundance of collagen, elastin, and hyaluronic acid. But as we age, you can see that there is a lack of these essential components that provide the skin its tensile and elastic properties. So what happens in the aging process? Well, it is based on intrinsic factors and extrinsic factors. So genetics, thinning of the skin, the presence of fine wrinkles, dry skin, telomere shortening. Telomeres are the caps that are found at the end of our chromosomes, and shortening of these contributes to the aging process. Also fluctuating hormone levels, particularly decreasing estrogen around the time of menopause, oxidative stress and mitochondrial dysfunction. These all lead to impaired function of the skin barrier. Now, the extrinsic factors, these are essentially environmental factors that speed up the intrinsic aging process. These consist of pollution, smoking, alcohol, nutrition, impaired sleep, stress, and ultraviolet light. So now let's move on to look at sun, vitamin D, and skin cancer. Sun, is it our friend or is it our foe? Vitamin D, we've known since the 1920s that it plays a crucial role in bone health and preventing rickets. But we've also since then discovered that it regulates more than 200 genes, and it plays an important role in immunity, both in terms of infectious diseases and autoimmune conditions, such as rheumatological conditions, also in cardiovascular health. And there's actually ongoing research looking at its role in cancer. And vitamin D is not actually a vitamin, it's a prohormone that's produced in the sun, in the skin during exposure to sunlight. And it's particularly the UVB rays that it needs exposure to in order to be synthesized. You require around 10 minutes per day for paler skins, and around 25 minutes per day for darker skins in order for the vitamin D to be synthesized. But the problem with countries like the UK that lie in northern latitudes is that during the autumn and winter months from October through to March, we just do not get enough UVB from the sun to activate this vitamin D synthesis. So that's why it's actually recommended that we should all be taking a vitamin D supplement. And as we've already mentioned, we know that vitamin D has a role in protecting us against infectious diseases, in respiratory infections. And whilst the data on COVID specifically is not yet conclusive, there is growing circumstantial evidence that it does have a significant role to play. So on one hand, we're told that we need more sun exposure for vitamin D activation, yet on the other hand, we're told to avoid the sun due to the risk of skin cancer. So it can be really, really confusing. And the rates of skin cancer have risen so significantly since the 1970s that melanoma is now the 5th most common cancer in the UK. And every year, approximately 15,000 people are diagnosed with melanoma. And the main risk factors for melanoma are UV exposure. And in fact, the Royal Marsden Hospital actually cite that significant sun exposure in childhood is the single most important lifestyle risk factor, and that blistering sunburn during childhood or young adulthood actually doubles the chances of developing melanoma later on in life. And then other risk factors are fair skin, genetics, immune deficiency, or a large number of moles. And with melanoma, we are really looking at these changes here, the ABCD, asymmetry, if the molar lesion's looking asymmetrical, border, if it's got an irregular border, if there are any mixed colors or color changes, the diameter, particularly if it's 6 millimeters or above. Sometimes melanoma can be smaller, around 4 millimeters. Also, if the mole is evolving, if it's changed, if it's become itchy or bleeding or irritating, then these are all warning signs. And the other type of skin cancer is the non-melanoma type. This consists of either the BCC, basal cell carcinoma, or the SCC, squamous cell carcinoma. And whilst this type of cancer, non-melanoma, are not metastatic, they can still cause significant localized destruction of the tissue. So can lifestyle play a role in skin cancer? Well, we know that sun protection is critical. So wearing a sun block of an SPF minimum of 30 to provide protection against UVB rays. And also it should have a UVA rating, A is for aging, of 4 or 5. We should also be wearing a wide-brimmed hat in the summer, seeking the shade and avoiding the intense midday sun. And also there's been some research into looking at tomatoes, because tomatoes are rich in a chemical called lycopene. And studies in the last 2 decades have shown that eating tomatoes or tomato-derived products has shown that there's a decrease in sensitivity to UV light, and as a result, decreased sun-induced redness by around 40%. Now, there's also a role of vitamin B3, which is also known as nicotinamide. This plays a role in the repair of melanocytes. And studies in Australia have shown that vitamin B3 is safe and effective in reducing the rates of new non-melanoma skin cancers, such as SCCs or BCCs, and possibly they might play a role in the prevention of melanoma, but there is ongoing research in this. And whilst this is common practice in Australia, it's not quite common practice in the UK. So let's look at modern day skin problems. Let's have a look at acne first. Acne, it's really common. The worldwide prevalence is about 9.4%, and approximately 85% of adolescents are affected. And it takes up 3.5 million GP appointments each year. We think it's multifactorial. Genetics are involved, hormones, it's an inflammatory condition. Environment also has a role to play, particularly diet. And acne causes significant psychological distress, and it causes painful infection and scarring. So what happens in acne? Well, you can see from this slide here, this is a healthy sebaceous gland here. This is the pore, and this is known as the pilosebaceous unit, which contains the hair follicle. When there's an accumulation of sebum from the sebaceous gland and an accumulation of dead skin cells, known as hyperkeratinization. This blocks the hair follicle, it plugs it. And then you then get proliferation of the bacteria C. acnes, which results in inflammation. And just on the right-hand side here, you can just see the different types of acne pimples. This is a healthy pilosebaceous unit. This is a whitehead where the pore is sealed within the skin. An open comedo, or known as a blackhead, where the skin is open. Then you get infection, and then you then develop the papule into a pustule. So let's look at the biochemistry, what's happening from a biochemical perspective in acne. Well, something called IGF, insulin-like growth factor, and this actually decreases something called FOXO1. When there's a decrease of FOXO1, there's an increased activation of something called mTORC1. Now, mTORC1 is involved in cell division and metabolism, but in acne, what happens is that mTORC1 leads to a production of excess sebum and hyperkeratinization, which is the dead skin cells. And then these then lead to the development of acne. Now, dairy and meat contain an amino acid called leucine, and leucine directly increases the activation of mTORC1, which again then feeds into this pathway, leading into a high incidence of acne. Also, having a diet that has high GI index, so high in sugars and also in dairy, again increases circulating insulin, which then results in increased IGF-1, and increased IGF-1 also directly increases sebum production. It also increases the amount of circulating androgens, which again increase sebum production, again all feeding into the development of acne. Now, omega-3 fatty acids can help to lower the inflammation aspect of acne. So let's look at other causes or exacerbating factors of acne. Well, over-cleansing can be a problem. The use of hairstyling products, oils and serums, having a fringe, wearing hats and helmets, these can all contribute to something called forehead acne. We've already discussed the role of processed foods, high sugar, high fat, and dairy. And mobile phones, these are teeming with pathogens. You know, they are a transmitter of bacteria. And also sweaty gym clothes. You know, if you work out and you don't change out of those sweaty gym clothes or have a shower, then that can also trigger the development or exacerbate acne, particularly on the back or the chest. So what are the treatments for acne? Well, it's dependent on severity. Traditionally, topical benzoyl peroxide, topical antibiotics, topical retinoids. In more severe acne, you might use oral antibiotics, and in females, Dianet. And in very severe acne, oral Roaccutane, which is prescribed in secondary care, or laser treatment, which tends not to be available on the NHS, but is available privately. Are there lifestyle measures that you can do to improve acne? Absolutely. We know that nutrition plays a significant role in our skin health. A whole food plant-based diet, which is rich in antioxidants, such as vitamin A, C, and E. These are all crucial for skin health. They also contain, a whole food plant-based diet also contains omega-3s, which are anti-inflammatory. And citrus fruits, such as vitamin C, which are antioxidants, these also help stimulate collagen productions. And as we've alluded to, tomatoes, which contain lycopene, they are anti-inflammatory. Sweet potatoes and carrots, which are rich in beta carotene, which is vitamin A, play a significant role. Avocados, walnuts, rich in vitamin E, very good for skin health. And dark leafy green vegetables contain a type of carotenoid called lutein, which is also an antioxidant. And we also know from studies that stress can exacerbate acne, so it's also important to employ techniques to manage your stress levels. So let's have a look now at dermatitis or eczema. Dermatitis is inflammation of the skin. We think in 50% of cases it's genetic due to a mutation of the filaggrin gene. 1 in 5 children suffer from it, 1 in 12 adults, and it causes severe itch, redness, and a rash. So what happens in dermatitis or eczema is that there's a breakdown of the skin barrier, and then you have immune changes due to these antigen invasions, again, resulting in the itch, rash, and infection. So triggers, are there triggers for eczema and dermatitis? Absolutely. Cow's milk allergy protein in infants can be a trigger. Contact allergens, pollens, central heating, particular problem in the winter months, air conditioning, a problem in the summer months, clothing, such as wool, food allergies, swimming in chlorinated water, house dust mites, hard water, and pollution can all be triggers. So what are the treatments? Well, exclusion of the trigger factor, if it's identifiable, the use of topical emollients, topical steroids, or immunomodulator creams such as Elidel or Protopic. And in more severe cases of eczema or dermatitis, we would use phototherapy or systemic medications such as methotrexate, azathioprine, cyclosporin, or biologicals. So are there lifestyle improvements for dermatitis? Absolutely, yes. Exclusion of the trigger allergen. And the most offending foods for dermatitis are cow's milk, eggs, soy, gluten, nuts, fish, and shellfish. Also washing powders, shower gels, soaps, all can be triggers for dermatitis, as we've already discussed. Clothing and hard water. Hard water increases the exposure of sodium lauryl sulfates in soaps and shower gels, which irritate the skin. And there's a trial called the SOFTER trial, which has been running by King's College and in conjunction with the St. John's Dermatology Institute, Guy's and St. Thomas's Hospital. And they're looking to see whether water softeners can have a role to play in the prevention of eczema. We also know that decreasing processed foods improves dermatitis, eczema, and having a diet that's rich in whole food plant-based diets, so including fruits, vegetables, legumes, nuts, and seeds, improves dermatitis. And also there's been some interesting studies from Korea looking at fermented foods such as kimchi, which have also been shown to have a reduced incidence of dermatitis. So let's now move on to psoriasis. Psoriasis, it affects 2 to 3% of the global population. The peak onset of age is around 15 to 25 and 50 to 60 years of age. 30% of people with psoriasis also have psoriatic arthropathy, and there's an increased incidence of psoriasis with cardiovascular disease and diabetes. And also psoriasis is an autoimmune condition. It's inflammatory, it has a high cell turnover, and there is a genetic component to psoriasis. There's a family history in 40 to 50%, and 75% if the onset is less than 20 years of age. The lifetime risk of psoriasis is 4% if there's no family history, and 1%, 28% if one parent is affected, and if both parents are affected, then that risk goes up to 65%. Now, psoriasis has a huge social stigma attached to it, and we mustn't underestimate the mental health impact that psoriasis has on its patients and the decreased quality of life as a result. So as I alluded to, there is normally normally the skin turnover is every 28 days. However, in psoriasis, this is sped up, so that the skin is turning over every 3 to 4 days due to an inflammatory response where the T cells trigger release of cytokine chemicals, resulting in redness, itchiness, scaliness, and plaques. And are there triggers for psoriasis? Absolutely. Stress, alcohol, smoking, infections, obesity, drugs such as ibuprofen, beta blockers, lithium, even injuries such as a cut or an abrasion or sunburn, and this is known as the Kubner phenomenon. These can all trigger psoriasis. So what are the treatments for psoriasis? Well, emollients, vitamin D analogues such as calcipotriol or calcitriol, tar preparations, and in severe cases we use phototherapy, oral systemic medications such as methotrexate, cyclosporin or acitretin, and also biologicals such as the TNF blockers. So are there improvements that you can do through your lifestyle for psoriasis? Absolutely, indeed. There's an abundance of evidence showing that a whole food plant-based diet can help. Decreasing stress will help. Exercise, increasing your exercise will help improve psoriasis, as will reduction and elimination of alcohol and the cessation of smoking. So just a couple of thoughts as the presentation comes to an end. I hope I have shown to you that through lifestyle improvements such as sleep, which is important for the repair and regeneration of skin cells, it decreases cortisol levels, improves hydration, maintaining a healthy weight because obesity alters the skin barrier by increasing the amount of exercise we do and maintaining physical activity because this slows down aging, reducing our stress levels because this decreases inflammation, stopping smoking because of the association with oxidative stress, watching our environment in terms of sun protection, pollution, hard water, decreasing or eliminating alcohol because this decreases inflammation, and a whole food plant-based diet that's rich in antioxidants such as vitamin A, C, E, omega-3s, lycopene, lutein. All of these are such important aspects of our lifestyle, which help in ensuring that we have healthy skin. Because skin is the outer reflection of our inner health. Thank you very much. And I just have some references here for you if you wish to have a look at these. Thank you very much for your attention. Thank you.